It's Hanya Oversby from Health Business Network. Thanks so much for joining me. The reason for bringing you along today is you're a specialist, one of the highest regarded specialists in regards to setting up and creating successful practices in the healthcare space. And it's such a time of challenge, and there's so much recycling of information online. There's so much negativity in the media, and we want to bring some optimism. We want to bring some creative thinking and some experience to our doctor network and share some of your insights and throw a few questions at you today. The first one being, if I'm an aspiring doctor and I'm wanting to set up my own clinic and this has come along and thrown my timeline off course, what should I be doing with my time?
With a doctor that's starting out in practice, it's when we're working with doctors at this stage, it's all about the planning. So I suppose this is the perfect time to really invest in planning for your practice, including doing the cash flow forecasts. But what you need to take into consideration now is the landscape is changed. As of COVID-19, things are different. So it's been a disruptor in for existing practices, because cash flows stopped. They've had to deal with staffing, asking them to step down. There's no income coming in. Yeah. So anytime there's a disruption in history, people have had to reevaluate and look at how they're going to do things differently. You know, over the years, the Great Depression would have been that happened. Then after that, they started doing things differently, or, even the introduction of the internet, or, maybe a surgical procedure gets replaced by a device being introduced. So in your planning, we're going to have to look at setting up your medical practice a lot differently.
Yeah. So change is inevitable, and these crises bring massive change. You touched on something there around cash flow issues around businesses. I guess this is something unforeseen in healthcare. You would imagine no matter what economic downturn we've faced in the past, in most cases, healthcare businesses are seen to be, and said loosely, recession-proof. Are you finding that clients and doctors in general are surprised that they're going through these challenges, and how are they coping with it?
Look, yeah, a lot of them are surprised, especially in the doctors who are in that non-essential landscape.
Yeah.
So where your service provision is discretionary, whether it's from in an aesthetic space or you're dealing with people's illnesses that can be delayed, that's where that's affected those businesses the most. Mm-hmm. Those businesses that I've been working with that provide essential services, such as cardiology, for example, or anything like that, they're booming actually, and they're growing through all their testings and things like that. But for this instance, that's just been luck of the draw. Yeah, so we're working with businesses. We're going to have to look at their service provision and start thinking, what if this does happen again? Do we need to look at all the clinical services that we do provide at our practice? Do we need to introduce some others that could be not subject to this kind of risk again? Is that introduction of essential services into our businesses? Do we need to introduce a product to our business that can generate an income, even if I can't clinically provide a service?
More diversified offering for patients. And do you think doctors might be scared to start business now? I mean, if you're not a little bit scared, something's wrong. But do you think they'll be more fearful to go into business?
Yeah, I think they would be. I mean, because this just happens so quickly. But I think rather than being afraid, you should see it as an opportunity to say, how can I run my business in a lean way very quickly? Mm-hmm. And the best way you can do that is, what can you bring in the business that doesn't require you to engage or employ somebody? So, for example, I might start up my specialist practice, and traditionally people have engaged admin staff that do their billing, that do their bookings, that do their typing, that do their whole one-stop shop.
Yeah.
Do you have to start thinking, hang on a second, if I outsource the typing, the billing, the this, the that, if my business shrinks, I'm down to a few core staff members, and those services are just not paid for because they're not being used.
Yeah.
Different ways of thinking about things.
So leaner operations, more diversified, and taking this time to work out how they can be bringing different services that they may not have thought of previously, and perhaps more collaboration then, do you think, between healthcare professionals?
There's a few things. One, the doctors that we're all working with, they're very highly educated and highly trained, but a lot of them hone their clinical skills into one particular area. Is there an opportunity for them to do other things in their clinical repertoire that they could access more quickly? For example, a plastic surgeon that does a lot of cosmetic procedures or big surgeries, but they're actually trained up very highly as excellent skin cancer doctors, and also a lot of them do a hand and reconstructive qualification. Is that something that they can draw back and do when they're not allowed to do those other types of procedures?
Okay. So do you think we might see doctors looking at further training and upskilling and looking at other areas to specialise in on the back of this? Or do you think it's not a big enough downturn for that?
No. Yeah, I don't think it will be big enough. I just think they just need to be mindful that they can pivot. I think pivoting is probably the key word in any business moving forward from now on. Can we take what we do and pivot 90 degrees or 180 degrees using the same infrastructure if required?
Yeah.
And does that mean that doctor actually has to provide that service? Mm-hmm. Do you have allied health in your business that could be ramped up in that time? Are you selling some sort of products through your practice that people can still purchase online? So a lot of the aesthetic practices that I've worked with were doing quite well just through their online skin sales because they focus their marketing through that.
So I guess the key thing here for people to understand that aren't in the medical space is that at the end of the day, it is medicine, but it is business. And if the business doesn't survive, there is no medicine. And that's not good for the community either. So one last question for you, Hanya, before we wrap up. You've seen a lot of businesses succeed and you've been a part of those businesses. And I'm sure from a distance, you've even seen some businesses that should have succeeded but didn't. What's the biggest mistake you see business owners make, doctor business owners?
Do you know what? I think the biggest mistake I see is that firstly, the business owner having an understanding where they sit in their own organisation and as the leader of their organisation, and through that leadership, setting up an organisation that has a clear vision and mission, clear goals, where we're going, so everybody can come along on the journey. And that's in that proactive way. Businesses that operate in that way and constantly improve generally succeed well. Those businesses that let things happen to them and are reactive are the ones that generally suffer.
I guess that strategy and planning is somewhat a creative skill set, which might not always be a strength of a doctor as well.
Absolutely. In fact, that's why we exist. Doctors, they spend many, many years being trained up to be excellent at what they do. They have to have business knowledge to set up their practice, but they don't get any training in that. So that's exactly where we step in. We join them on that sort of business journey, become a trusted advisor and work with them and their other advisors to really function like an organisation that's heading towards success.
Beautiful. Hanya, so many learnings. Diversify, lean up the business and focus on your vision, focus on your mission, get everyone aligned. Thanks so much for your time.
Thanks, Julian.